All right. So again, thanks so much for doing this. First off, tell the audience a little bit about yourself and how you got started in the community.
Sure thing. Laszlo, I wanted to say thank you for having me on. My name is Sitara Marin, and I am a clinical mental health therapist. I have a private practice called Sitara Marin Therapy, lack of a better title, but we also call it SMT for short. And I specialize in identity in all of its forms. And this specialization, it came about when started realizing that over the years working with my clients, that we would always kind of come back to identity. And that would look like how we're perceived by other people, increasing self-confidence, or even honing our sense of self. And so I started to realize that all of these themes fit under the umbrella of identity. And so now I base my practice on the cultivating of identity.
Mm-hmm. All right. So tell me a little bit about the work that you do in your current role.
Sure. So I provide psychotherapy to adults and teens that are 16 years old and up. I work with individuals that are on all ability levels, cultural backgrounds, socioeconomic status, and I really enjoy exploring parts of my client's identity with them and removing any barriers that prevent them from becoming their full selves. I have a few clients who identify as disabled, and we talk about how their disadvantages hinder or help them find their purpose in life. And it's having that unique perspective on life that allows them to show up as great. A great leader, a great thinker, a great artist, a great visionary. And to me, even this podcast is great because it sheds light on an area that tends to be overlooked.
Mm-hmm. Well, yeah, thank you so much. I really appreciate it. So if I could ask, like, what is psychotherapy? Because I've never heard about it before.
Yeah, so psychotherapy, I guess that's the more, I don't know, medical term, psycho meaning like your mind. So it's mind therapy, mental health therapy. I think is probably the phrasing that people are more used to hearing is mental health therapy. So
Mm-hmm.
that's just another way of calling it.
Yeah. So, like, what methods or approaches do you use with your clients?
Yeah, so methods and approaches, and I mean, I could go into all sorts of detail about this. My primary psychotherapy orientation is psychodynamic, and that's kind of based off of Freudian psychoanalytic. It's kind of the newer age version. We take out all the weird stuff and we keep the good stuff. But more or less, that focuses a lot on the past and childhood and those primary adult influences that we had in our childhood. So that's one aspect that I focus on. The other is a more existential approach. And that's kind of how we talk about what is our purpose in life. How do we know, like, what meaning that we make as we contribute to the world in some way? And then the third piece is sex therapy. And that really brings in the identity pieces and how we want to be received and perceived by other people as, what are our sexual identity, our confidence, our sense of self, all of that kind of falls under that sex therapy branch of things. So those are the three components that I use in my practice and with my clients.
Mm-hmm. So, what have people said about their experiences with like visiting you and like, and consulting with you and like sessions and stuff?
What have they said?
Yeah, what have their experience been like, you know,
Yeah.
seeing you and working with you?
So my clients, and it's interesting because typically we'll do kind of a once we've gone through a whole treatment cycle, we'll kind of talk about feedback and how things have been, and it's what they say is that it feels like a non-judgmental space. That many of the thoughts that they've had that were like, I don't know, is this bad? Is this good? Is this weird? Is it that they can bring it into therapy and we can and I help them to understand like what's a normal level of thinking, helping them to put things into different buckets. I call myself a thought organizer, and I help people kind of organize their thoughts. And what ends up happening is as we start to recreate and hone down like what are these pieces of identity, like who am I really, not who am I supposed to be, or who was I 10 years ago, who was I in childhood, but who am I today, and who do I want to be. Then people start to like slowly pivot, right? It's almost like a ship in the ocean, right? And the tides are changing it ever so slowly to go in this like new direction. And what happens is they go through this sort of cellular change where they behave differently, sort of naturally in all different environments, and at home, at work, with different family members, they can behave in this way that feels more in alignment with who they are.
Mm-hmm. My next question is how can sort of psychotherapy, be this sort of gateway or tool to help people, find what they're looking for and figure out their struggles and all of that stuff.
Yeah, that's a really good question. I like that. So, when I think about my clients and I think about kind of all the varying ability levels that they have, I want them to feel good and confident in themselves. I want them to like own their privileges and their disadvantages, and I like to call that kind of their light and shadow sides, the sides of us that we like to present to the world, and then the ones that they like to keep maybe a little bit more hidden from the world, but kind of owning all those parts of ourselves. And then that way they're better able to advocate for themselves. They can speak up for other people who are not able to speak up for themselves. They can ask family and friends to kind of slow down, consider me, include me. Um, and I think that's kind of how this ends up working with people as they go back into the world after sessions over. We press unpause on our life and kind of go back to whatever it is that they're working with in this new way of being.
Mm-hmm. What can other upcoming psychotherapists and like people who are wanting to be in your position now, what can they sort of learn to sort of help them help clients, be the best that they can be. Like, because I know psychology and it has a lot of different branches and a lot of different areas. So, like, what advice would you give to like those in your position or who want to be in your position, who want to pursue this career?
Yeah. I would say walk the walk. If you are going to be guiding other people through their lives and ups and downs and traumas and all the things that life comes with, then having had walked that walk as well. So I definitely suggest for other therapists and other therapists in training to go through their own treatment cycle with psychotherapy, to uncover their own sense of identity. So that they can stand firm when their clients are going through whatever chaos they're going through, that they're better able to hold and guide them with the most love and care that they can, because they are still solid within themselves.
Mm-hmm. Yep.